Good morning, welcome to, I think this is my third HIT conference, and there's as much energy and buzz and vitality in this room, if not more actually, 3 years on. And I want to comment on that when I talk about the year that we've had, and also touch on looking ahead and what the board's thinking about the future. And I want to share some of that with you. David will also go into more detail. But first of all, I think it's really important to acknowledge all the brilliant work that HITs have done and all the associated groups who work with us at Bristol Health Partners, because many of the achievements and the ideas and the innovation and the drive to really make services better for patients is coming from the people who are working in the HITs and all the partners who are working alongside them. So I don't get an opportunity to do it very often, but today I want to say a big thanks to all your efforts. So I haven't worked out how to move the clicker. First principle. Okay, so what have the board been involved in? I think one important thing that we wanted to do is really make 2015-16 the year that we took stock. Where have we got to so far with our HIT strategy, and what does the future look like? We recognise that you could probably, there's different phases to how HITs have progressed, and there's something really exciting and dynamic about a very bottom-up approach that's really important to sustain and maintain. But also, some of the variability and the challenges that HITs were experiencing, we felt as a board we needed to understand how could we better support some of those HITs and ensure that their ideas were going to be implemented and make a difference, because that's what it's all about. So I think we're trying to combine the benefits of that bottom-up energy and innovation, but actually move towards more of a managed approach that fits with priorities that people in the system recognise as the things that Bristol really wants to achieve and that all partners are signed up to. So we did two things, and I think David will talk in more detail about this. But we asked Jenny Donovan through the clerk to do an evaluation of progress to date. And that will be written up into a report that will be shared with everybody. But I'll pick some of the highlights around it now. But also, we'd asked David Wynick to work with Jenny in looking at the evaluation, not a formal evaluation, I forget I'm talking to researchers here, proper researchers, a review, building on the review to then look at, well, what did that mean for the future direction? And again, I just want to highlight some of that work and those very, very early findings, which again will be shared with people. So evaluating HIT learning to date, reviewing the HIT strategy going forward. We also, thankfully, landed a permanent Bristol Health Partners director in 2015-16. That was by no means insignificant, because I do also want to thank David, who kept the fort going during quite an extended interim period following Peter Matheson's departure. So that'll tell you how long ago it was. It's probably time for Peter to be coming back soon. David has done a really great job since he's been substantively appointed, and we've really had a bit of a drains up about how do we make Bristol Health Partners really work together and be greater than the sum of our parts. So we've done some work around strengthening the executive committee, which works with Bristol Health Partners. Lots of people, lots of energy in the executive group when I've attended. Lots of enthusiasm. How do we harness that to making sure that HITs deliver and BHP is successful? So we've done some work around the executive group and then trying to align that with the board, and what I've called as leveraging our clout. So if you are an organisation that's on the board, how do you sponsor and help the HITs deliver, and what's our collective and individual responsibility to making sure that things happen and move forward? The other thing that I can't not mention is changes in the context for all of us. The NHS, local government, we've had lots of changes in the university this year with new appointments and a new strategy from the University of Bristol and obviously discussions about devolution to Greater Bristol, including North Somerset and, well, not now, including Bath, South Gloucestershire and Bristol. And so those things do mean something for Bristol Health Partners because whilst the core of what we're doing is about population health, in terms of being clear about how we can drive a single agenda, understanding what the system is around us and how we can work with those partners is really fundamental. So I'm going to touch a bit on the new sustainability and transformation plans, but David will say more. So all of those things are really changing our context around us. And we have a workshop now planned for the board and the executive group in September to say, okay, how does Bristol Health Partners adapt and lead in that context and deliver the things that we want to do? So the evaluation, and many thanks to Sabby Redwood and team who worked with Jenny on this evaluation, and to the HIT directors who gave up their time and talked openly and very richly about how it had felt and some of the things that were difficult and some of the things that they had managed to achieve. And I have to say that when we got this feedback from Jenny and team, what I would say is I don't think delivering change as a HIT is any easier or harder than delivering change per se. Many of the comments that people make, I could extrapolate to people in my organisation who are trying to make service change and service improvement, as you probably could in almost any organisation. So I think change is difficult for lots of reasons, you know, there's opportunities and there are challenges of the HIT model to drive that change. And the issue for us is how do we capture the opportunities and then move through the challenges and the difficulties. So these are the things that HIT directors told us about. That some of the benefits are you could move on your research proposals quickly, which brings money into BNSSG, that's good, with the success in funding applications. So we're getting better at being able to attract national and international funding into Bristol and beyond, and that is very positive. And obviously developing capability. And fine-tuning our research capability, which probably is pretty good anyway, I would think. Just a selection of some of the achievements that people talked about. So this is by no means exhaustive, but just a few pictures to share with you. The expert care, Renoir, eye disease has been phenomenally successful in terms of outreach, and probably lessons to learn, particularly from this HIT that could be extrapolated, and we need to think about how we share that. The dementia diagnosis, moving that to primary care, just looking at the difference here, moving, I'm just checking the timescales, 2012 to 2016. So we've surpassed the national target in Bristol through the dementia HIT and the work that people are doing. And that, actually, sometimes this is no more than just raising awareness. I'm not saying that's what they've done, but you know, energy, ideas, driving the data, driving the importance, raising awareness, all of that starts to shift the curve. You know, small actions make a big difference. And then obviously something close to my heart, the Bristol Brain Centre, which opened this year, which supports research in many movement disorders and is passionately supported by patients and users. It's a very buzzy, exciting place. I'd encourage people to go. This has been supported through the Move HIT. So looking ahead, what's the year ahead? We need to refresh our partnership agreement. That hasn't been looked at since 2009. So you can see that it probably is time, given all the context changes, to try and capture and bring together what we think that Bristol Health Partners really can deliver for our population and for the wider system. What we talked about, part of the evaluation of the HITs identified that where people felt they weren't reflected in a CCG commissioning priority, that the challenge was much harder to make an impact and get the attention of the people they needed. So without necessarily losing all the bottom-up enthusiasm and ideas, what we've said is we need to get better at lining up system priorities with our selection of HITs. And if we select a HIT and support a HIT, we absolutely need to give it 100% support. So it's felt more of a freely evolving relationship, but I think what we're saying is actually that's meant that people have felt frustrated because they haven't always felt as supported, not necessarily from the team, I'm not saying from the Bristol Health Partners team, but actually from the partners in Bristol Health Partners. So lining that up, being clear that if we support a HIT, we've got to put all our weight behind implementation, delivery and impact, chase down the problems that come people's way. The new Sustainability and Transformation Plan. So David's going to say a bit more about this, but this is a fundamental shift in the NHS. And I'm really pleased to say that in BNSSG, Bristol, North Somerset, South Gloss, we've been working really well together as health leaders with social care involved, and in particular, actually, the 3 social care partners have been working very well together, giving us a social care single consistent view and approach. So all of that augurs well for the future. But certainly on the NHS side, the view is that the Sustainability and Transformation Plan sort of replace all other planning, individual organisational plans. This will be the plan that governs how we make big change for our population over the next 3 to 5 years, and the emphasis being on transformation, but also recognising that we need to deliver care for more people in a cash-constrained system. So good engagement, and it's pity about timing because I don't think we're quite there yet. Otherwise, I think we would have been able to share some headlines with you. But I think there's a lot of ambition in our group to really make some of the changes that need to be made to deliver a much more sustainable, but also, I suppose what I'd emphasize is I think everybody is driving consistency. So consistency for the patient, consistency for the member of staff who works in either health or social care, a single offer right across BNSSG, and then how do we standardise in order to deliver that? And that obviously improves safety, it improves quality, but it makes it easier for the patient to know where they are. It makes it easier for the patient to be engaged in that system because the expectations can be laid up front. So much greater consistency and reliability, and a lot of work to achieve that. And I mentioned strengthening the sponsorship role of host HITs. I think we feel acutely aware that HITs do come from the bottom up, and I don't want to lose that, as I've said several times. I think it's great that people have the energy and the ideas, and we have to harness and support that. But actually, if you're authorised as a HIT, we recognise that there's a responsibility of the sponsoring organisation to get behind and make it successful. So that's some of the highlights of looking ahead. David's going to talk now, then I suspect any questions at the end. Is that right, David? Yeah, good. Thank you very much. Oh, I've got lovely pictures to show you. Hang on a minute. I can't miss that. So I just want to briefly say Bristol Health and Care Awards. Why was that important? It was about the profile of all the good work that you people and the staff that you work with do in Bristol, and getting that acknowledged and understood. And I have to say that the editor of the Bristol Post came up to me afterwards and said, we run lots of these events, but he said, I've never seen such compassion, kindness and energy and enthusiasm in a room before. People really want other people to win. It's a very, very interesting culture that you have. It's very different to any other industry that we serve. So let's hang on to that and celebrate it. Thank you very much.
Thank you very much, Andrea. I'm going to talk a little bit more now about some of the things that I think are going to kind of shape the next year or so. The HIT review is a really, really key piece of work for us as a partnership, which will kind of kick off in July and then run over the summer and the autumn. And from my perspective, this is really about kind of addressing kind of two a number of key issues. So the first one is we need to acknowledge the importance of the strategic direction that is now being set across the health system. The sustainability transformation plans, the developing JSNA and how its functionality is kind of being developed and changed, and the developing priorities of health and wellbeing boards. But that also presents us, I think, with a really, really significant opportunity, because there will be work that HITs are either doing or want to do that actually connects quite directly to the priorities that are set out in those documents. So that's the first thing that we're going to be looking to do, is going to be looking for opportunities to align work with those priorities. Because where it's possible to do that, then we will be able, I think, to secure in a more ambitious way than maybe we have to date, the real kind of the joint support from across the partnership to actually drive those forward that Andrea talked about in her talk. Now, I want to make it quite clear at the outset here that we aren't expecting you as HITs to align all of your activity or your objectives with the STP or with Health and Wellbeing Board strategy. Because there will still be a degree of work that you want to do which is going to play out over a long time scale and doesn't happen to coincide with what the system level priorities are for the next kind of 12 to 18 months. But we need to acknowledge the importance of those priorities, and I think we would be missing a huge trick if we didn't take the opportunity where we can to align HIT work streams with those priorities and then to put more support behind them. Inevitably that will involve a degree of prioritisation. So although I think we'll be asking for maybe 2, perhaps 3 potential work streams from each of the HITs, we won't be able to support all of those. I don't know how many we will be able to support. We've made some provision in our budget for what we call the HIT Implementation Fund, and we're going to start using more of the partnership's core funding to support HIT implementation more directly, as opposed to the kind of general functioning of work of the health integration teams. And then the second issue, which I really hope that this review helps us to get better at, is bluntly getting better as a partnership at lining up our resources and a kind of joint commitment to the implementation proposals coming out of the health integration teams. We have reached a stage now where a number of you are proposing, I think, well-evidenced proposals for service change, and the way in which we kind of bring those together and support them as a partnership is something which we need to get better at. So the HIT review is I think, about acknowledging the importance and the kind of centrality of things like the STP, taking opportunities where we can to align the work of HITs with that and to support them more directly and ambitiously, and then in a more general sense, helping us as a partnership to get better at, and this again will involve, I think, some prioritisation, get better at providing joint support and, where it's appropriate, funding to these implementation proposals. So it isn't a question of, you've got to sing for your supper, and if you don't connect to the STP, that's it. There'll always be a body of your work which won't connect to this, but I would urge you where you can to take opportunities and be imaginative about this, to connect your work streams to the STP, because it is absolutely central to the way in which health and social care will work over the next 3 to 5 years. So just want to drop these in as well to finish with, because these are some of the other things which occupy my mind and to some extent kind of shape the way in which I'm trying to work as a director and some of the work we're doing as a partnership. So the first one is I'm just really trying to retain a focus on, if you like, exploiting and making the most of the diversity of the partnership. And so where it's possible to do so, please also ensure that you are looking for and sharing ideas about how we do this. Because that, I think, is absolutely core to our value as a partnership, being able to demonstrate the way in which we have brought a range of partners together and the way in which we create, as a partnership, value for each of those partners. So the more and more diverse set of collaborators, particularly across the partnership, that your work can involve, the better. As I said before, our collaboration agreement, and we must do this, gives us the opportunity to clarify the distinct value and role of BHP in Bristol, and plug into and kind of acknowledge the context of this kind of complex series of organisational networks and some of the key strategic priorities which they're setting. Any strategic work that we do, it seems obvious to me that it should align to or connect with those developing kind of system priorities, and as well as the work we're doing with the HITs, will be any strategic work we do will be explicitly and kind of linked into that agenda, something which, you know, I don't think we've been as explicit about in the past as maybe we could or should have done. And then another one, which is just a sort of more general thing, and again, this isn't something which I think we aren't going to start asking people to, you know, send in your top 5 savings plans, but I would just, I think it would be remiss of me if I didn't kind of mention this, because it's really important, I think, to understand that for I think all the partners, but for a number in particular, particularly those who have a commissioning role, savings are really important, and it's important not just to be able to demonstrate the value in terms of patient outcomes or the value in terms of research translation. Where you possibly can, I would urge you to look for and articulate and share any financial savings benefits associated with your work. Now, in some senses that might be kind of incidental to your main priority and focus, but I think bluntly we will be missing an enormous trick if we don't start, you know, telling a better and more explicit story where we can about the way in which the work of the partnership has also helped to deliver savings or efficiency as well as these wider benefits. So again, I acknowledge, of course, that the priority for all of you is patient benefit, service change and research translation. But it's important, I think, to understand that where it's possible to do so, we need also to be able to rely on and tell people about the savings that are delivered. Okay, that's, I think, the end of my talk. So I think I've got a few minutes now, probably 3 or 4 actually. We've got I wasn't sure I had the time to do this, so can someone grab if you can, we've got some roving mics here. I'd be happy to answer any questions, and then I'll just then spend a few minutes kind of explaining the rest of the day, how the rest of the day will work. But thank you very much for coming, and thank you very much for listening to me. I'm around all day, and I'll be very keen to discuss any of the ideas that I've raised with you. But if there are anybody with some questions now, I've got a few minutes to answer them. Adrian, just over here. Can you just wait until the mic gets to you?
David, so one of the things you've said loud and clear is sustainability and transformation plan is central. For those of us that are involved in wider determinants HITs, where we're trying to keep people well and outside of the healthcare system for as long as possible, can you just respond to that to clarify for me, because I'm a bit slightly unsure.
Yeah. Okay. So I think so the first thing is that when I'm talking about the range of strategic priorities, then of course the STP is important, but so, for example, is the work that in the Joint Strategic Needs Assessment and the health and wellbeing board priorities. And I think that when you look at those in that kind of wider sense, then there's a clear reference to the wider determinants of health and the requirement to focus more on prevention. So I still think that there are going to be, you know, obvious and legitimate ways in which you'll be able to connect very directly to those. But I'm also pretty confident that the narrative in the sustainability and transformation plans will be very strongly focused on prevention. And then the other aspect of it as well, which I apologise, I should have articulated this nuance, is that when we're talking collectively about what we mean by, you know, kind of savings, we often kind of shorthand that by saying doing less with more. Now, I don't think that paints the full picture, because of course it's not just a question of doing the same things that we're doing at the moment in an increasingly constrained financial footprint. We have to get much better at finding ways in which we can manage and reduce the demand for those services in the first place. So that, I think, is as much a story that we can tell when we're talking about savings per se as just doing the same stuff but more cheaply. So thank you for that question. I'm glad I got the chance just to bring out that nuance.
Hi, my name is Mary Backhouse. I'm one of the CCG commissioners, and I just thought I'd like to just clarify. So the STP has 3 main programmes. The first is prevention, the second is about primary and community care, and the third is about acute hospital collaboration. So prevention is absolutely at the heart of the STP.
Thank you very much, Mary. Okay, I don't see any other hands up. I'm, like I say, here all day. Please come and grab me and let's discuss some of these issues.